Which method should be the last resort in assisting a patient who is experiencing mild anxiety? A. Therapeutic communication. B. Deep breathing. C. Progressive muscle relaxation. D. Administration of Haldol. Answer is D. Administration of Haldol. Non-pharmacological methods should be used prior to pharmacological methods. Haldol is normally given to patients experiencing severe anxiety or agitation and should be used as a last resort. A patient may benefit from the nurse sitting with them and providing calm conversation over the anxiety-causing issue. Deep breathing is a well-known calming technique used to calm the nervous system and can help in cases of anxiety or panic attacks. Progressive muscle relaxation can be used to encourage the patient into a more relaxed state. The nurse can assist the patient to lay on the bed and provide instructions to the patient in a slow, calm voice. Progressive muscle relaxation would be helpful for mild anxiety. In which of the following ways can the nurse promote the sense of taste for an older adult? A. Mix foods together on the dinner tray. B. Avoid cologne, air fresheners, or room deodorizers. C. Encourage the client to chew food thoroughly. D. Discourage the use of salt or seasonings with prepared food. The answer is C. Encourage the client to chew food thoroughly. As clients age, their sense of taste may diminish, reducing the joy that comes with eating. A nurse can promote the sense of taste for a client by encouraging him to chew his food thoroughly while eating. This results in longer contact of food with the taste buds and a greater chance of tasting the food. Which of the following is classified as a prerenal condition that affects urinary elimination? A. Nephrotoxic medications. B. Pericardial tamponade. C. Neurogenic bladder. D. Polycystic kidney disease. The answer is B. Pericardial tamponade. A prerenal condition is that which causes reduced urinary elimination due to a diminished blood flow to the kidneys. A condition such as cardiac tamponade affects the heart's ability to pump adequate amounts of blood, thereby reducing blood flow to vital organs throughout the body, including the kidneys. A nurse is assessing an African American client for risks of a pressure ulcer. Which of the following best describes what the nurse might find with an early pressure ulcer in this client? A. Skin has a purple, bluish color. B. Capillary refill is 1 second. C. Skin appears blanched at the pressure site. D. Tinting appears when checking skin turgor. The answer is A. Skin has a purple, bluish color. When assessing for signs of developing pressure ulcers in a client with dark skin, decreased circulation may not always be readily apparent. For instance, blanching, the red undertones seen in light-skinned clients, will not always be present. Instead, the skin of an early pressure ulcer may develop a purple or bluish color. At the beginning of the shift, a nurse receives report for her daily assignment. Which of the following situations should the nurse give first priority? A. A diabetic client with a blood glucose level of 195 mg per deciliter. B. A family member of an elderly client who has questions. C. A client with COPD with an oxygen saturation of 84%. D. A client who requires assistance to use the bathroom. The answer is C. A client with COPD with an oxygen saturation of 84%. When prioritizing needs of clients, the nurse must begin with the unstable client or manage conditions that affect airway, breathing, or circulation first. The client with COPD has a condition that affects breathing and is exhibiting decreased oxygen saturation levels. Therefore, This client should be the first priority.